How to tell if you have a tapeworm. A tapeworm is a parasite that you can get from eating the meat of an infected animal. Tapeworms are often easy to treat, but they can cause some severe problems if left untreated. If you are concerned that you may have a tapeworm, then the best thing to do is to see a doctor as soon as possible. There are also some symptoms that you can watch for that may indicate that you have a tapeworm, but it is necessary to get a diagnosis to be sure. Part 1: Identifying symptoms. 1. Check for common symptoms. A tapeworm can cause a variety of different symptoms, so it can be hard to tell if you have a tapeworm based on your symptoms alone. But being familiar with the most common symptoms may help you to determine if you need to see a doctor. Some of the common symptoms of tapeworm include abdominal pain, nausea and/or vomiting, diarrhea, weight loss, dizziness, insomnia, malnutrition, jaundice, yellowish tinge to the skin and eyes. 2. Examine your stools. One way to tell if you have a tapeworm is to examine your stools for pieces of the worm. If you notice any particles that look like grains of white rice, then you may have a tapeworm infection. These small white segments contain eggs from the tapeworm. 3. Pay attention to your appetite. It is common to lose your appetite when you have a tapeworm, but some people experience an increase in appetite. This is more common in tapeworm that has been caused by eating undercooked beef or pork. Watch for any unusual changes in your appetite. 4. Look for anemia symptoms. Tapeworm caused by eating undercooked fish may lead to a vitamin B12 deficiency because the tapeworm may be sucking up all of your vitamin B12. This may cause you to become anemic because your body needs vitamin B12 to make red blood cells. Symptoms of anemia caused by a vitamin B12 deficiency include pins and needles sensation in your hands and feet, loss of sensation in your hands, no sense of touch, wobbly walk and trouble walking, feeling clumsy and stiff, dementia. 5. Watch for symptoms of a larvae infection. In some cases of tapeworm, the larvae may hatch and work their way through your intestinal wall and into other parts of your body. There are different symptoms associated with this type of tapeworm, and they include frequent, painful coughing, headaches, seizures, fever, allergic reactions such as wheezing, sneezing, itching, a rash, and swelling. Part 2: Getting a diagnosis. 1. Make an appointment with your doctor. Although tapeworm has some obvious symptoms, the only way to be sure that you have a tapeworm and not some other parasite or virus is to see your doctor for a diagnosis. Your doctor will do a physical examination and order lab work to confirm whether or not you have a tapeworm. 2. Collect a stool sample if necessary. One way that your doctor can determine whether or not you have a tapeworm is by ordering a lab analysis of your feces. Before your appointment, ask if you will need to collect a stool sample. 3. Get a blood test. If a stool sample shows negative results and you have symptoms that indicate that you may have a tapeworm, then you may need to get a blood test. A lab analysis of your blood will show whether or not you have been infected with a tapeworm. 4. Undergo an imaging test. If you do have a tapeworm, then your doctor may want you to have a CT, computed tomography, ultrasound, or MRI, magnetic resonance imaging, to see if a tapeworm has caused damage to other parts of your body. These tests are not painful, but they may be a little uncomfortable and time-consuming. Part 3: Treating tapeworm. 1. Take medication to help pass the tapeworm. The main treatment used for tapeworm is a medication called praziquantel. This medication will kill the tapeworm and dislodge it from your blood vessels so that your body can pass it. The normal dosage for the medication is 1 tablet taken by mouth 3 times for 1 day. Have some food and a glass of water with the tablet and swallow the tablet whole. Praziquantel has an unpleasant taste that makes some people gag and vomit. Make sure that you follow your doctor's instructions for taking praziquantel. You may need to take more or less of it depending on the severity of your tapeworm infection. Do not eat grapefruit or drink grapefruit juice while you are taking praziquantel. 2. Expect some pain and cramping. If you have to pass a large tapeworm, it is likely that you will have some pain and cramping. This is normal, but make sure that you call your doctor if the pain becomes severe. 3. See your doctor for a follow-up visit. To ensure that you are tapeworm-free, your doctor will need to check your stools again 1 month following your treatment and then again 3 months after your treatment. Make sure that you keep this appointment even if you are feeling fine. Tips. The main cause of tapeworm is eating undercooked meat, so you may want to make sure that any meat you eat is cooked well in order to decrease your risk of getting a tapeworm. Warnings. Do not attempt to treat a tapeworm on your own. Tapeworm infections can be severe and they require proper medical attention.